Hi, this is Dr. Ankita, one of the doctors here. What would you like to be called as?
Lena is fine, doctor.
Hi, Lena. May I confirm your age, please?
Yeah, I'm 35.
And what is it that you do?
I'm a homemaker.
I believe you are here as you have some period problem, as mentioned in your notes. Is it okay if I ask you a couple of questions before we proceed with the consultation?
That's fine.
So, could you tell me more about your periods?
Well, yeah, they are quite heavy, and I need to change my pads very frequently, about 1 to 2 hours on a every 1 to 2 hours on a heavy day. So I pass large clots also, which is causing me to worry.
hmm That does sound like significant bleeding, Lena. How long does your period last?
Usually about 5 to 6 days.
And do you have any bleeding in between periods, like
No,
spotting?
no,
Don't mind me asking a few personal questions. Are you currently sexually active?
yes,
And after sex, have you experienced any spotting?
no, nothing.
Do you have pain during intercourse?
Not really.
All right. I can see your periods are painful, as mentioned in your notes. Tell me about it.
Well, actually, they are quite painful, and I sometimes need to take these medications in order to manage the pain.
Mm-hmm. So, what are the medicines that you take?
Well, something called as tranexamic acid. I was told it would help with the heavy bleeding. Sometimes I to take another acid type of medicine.
Mm-hmm. And has the other medicine worked for your pain?
Slightly.
Mm-hmm. So, how is this affecting your overall well-being? You mentioned you worry about the bleeding. Are there other ways it's impacting your life?
Yeah, actually, the impact is quite significant. It causes me to worry a lot. I get very anxious.
I'll make a note of that, and I could put you in touch with counselors as well. Have you noticed increased fatigability or palpitations or breathlessness?
Not that I've given it a thought.
All right, we would check your blood strength as well. That is the hemoglobin, because you can have low hemoglobin because of blood loss.
Mm.
Can you tell me if you've been pregnant before?
Yeah, I have two children. Both were born normally. Deliveries were all fine. There was no problem during pregnancy
All right, and any future pregnancy wishes?
either. Yeah, I would hope so.
All right, any surgeries in the past?
No, nothing.
Any medical conditions you're being treated for?
I have thyroid problem, and I'm taking
Mm-hmm.
something. I'm not sure of the strength, but something called thyroxine. I've not been to my specialist in a long time.
Oh, is that so? Okay, we'll look into that as well. Is there any family history of significance?
My mom had severe similar problems as mine, heavy periods, and she ended up having her womb removed.
All right, and did she have it at a young age?
She was in her 40s, if I remember correctly.
Mm-hmm. Any allergies that you have?
No.
Are you well supported at home?
Yeah.
May I know your weight to height ratio?
It's 30.
Blood group?
Be positive.
Any reservation to blood transfusion?
No,
What about your smears? Have you been regular?
that's all normal.
Mm-hmm. Don't mind me asking, do you smoke?
No,
What about alcohol or any recreational drugs?
nothing.
Thank you for all that information, Mrs. Lena. Based on what you've told me, your symptoms, and the ultrasound scan, which is arranged by the GP, I
Hmm.
believe you have something called adenomyosis. Let me explain what that is. All
Okay.
right. It is a condition wherein the lining of the womb gets into the muscle layer of the womb and
Mm.
it bleeds every time you get your period, causing inflammation there, and that results in the pain and heavy bleeding.
Oh,
All right.
okay. Something like a cancer.
Oh no, adenomyosis is not cancer. It is a benign condition. However, if left untreated, it can worsen over time. And there is effective treatment that we have to improve your symptoms. All right?
My mom had her womb removed, as I told you. Will I also require one?
Or not necessarily. Your mother had hers in her 40s, as you mentioned, which was probably appropriate at that time. Nowadays, we have much better medical treatment options that could work for you. Okay,
Mm.
especially if you are considering a future pregnancy. All right?
o- Okay.
Mhm. So given your situation, we have several options, but firstly, we will need to check your hemoglobin, as I mentioned earlier. And since you have hypothyroidism, low thyroid, we would also check your thyroid function tests and possibly get an opinion from the specialist regarding your thyroid function.
Mm-hmm.
For the bleeding, we have certain options. You mentioned you are on the acid, that is a mefenamic acid, I believe, and tranexamic acid. We
Mm-hmm.
could continue regular these medications during your periods. You've already tried this, and since you're looking for something more effective, there are other better options as well. All
Mm.
right.
Okay.
So there is something called as the levonorgestrel intrauterine system. This is what I would recommend to you, as it's a T-shaped device that sits in the womb and slowly releases a small amount of progesterone over time. Progesterone is the hormone that protects your womb. It
Mm-hmm.
also acts as a contraceptive, and studies have shown that up to 70% of women would experience significant improvement in both bleeding as well as pain, particularly in this condition that is adenomyosis. All right?
Mm.
And during this time, we could offer you treatment for the low hemoglobin in case you do have a low hemoglobin, which may be in the form of oral tablets, that is, iron tablets or injections. All right.
Okay. All right.
We could
Uh,
also offer you combined oral contraceptive pills and progesterone hormone pills. But
mm.
these are pills that may be effective, but they would be taken, you would need to take them every single day, and they may have greater side effects as compared with the device that I mentioned.
Hmm.
All right.
Okay.
Okay.
I think I
So
would like to know more about this coil that you mentioned with hormones. Uh, how long can I keep it, and what if I want to conceive later? Is it going to have an effect in that?
that's a very good question, and let me explain. So the device lasts about 5 years, and after 5 years, we replace it with a new device in case you want to continue the device. You
Mm.
could have it removed in case you wish to have a pregnancy and try for a pregnancy soon thereafter.
Mm.
As far as the side effects of the device is concerned, let me be honest about what to expect. You could have irregular spotting for the first 2 to 3 months, and the period can become lighter or even absent after around 3 to 6 months. And this may be a welcome sign for some of the women. You could still continue ovulating. There could be some rare side effects like mild changes in the mood or slight weight gain, and rarely you could experience some cysts or these are fluid fill collections in the ovaries. But nothing to worry, nothing major. There may be slight discomfort at the time of insertion, and we could use an anesthetic to numb your neck of the womb during the procedure or certain painkillers as well.
Mm-hmm.
Some serious risks may include puncture in the womb wall, at which can happen in 1 in 1,000, and expulsion rates are around 2 to 5%, and infection is very rare. All right.
Okay.
You can return to your normal activities immediately afterwards. The
Mm-hmm.
threads that are present at the end of the device could be checked by you personally to confirm that the device is in place. We would give you certain information leaflets as well and an emergency contact number. You would be asked to return in case of certain red flags like persistent pain, discharge, heavy bleeding, or if you're unable to feel the threads. Till the
Okay.
device takes effect, you could continue the tranexamic acid and mefenamic acid. I would
Right.
also like to add here regarding your future pregnancy wishes, as you mentioned, adenomyosis due to the local inflammatory response may affect your ability to conceive, and as such, you may need help as far as pregnancy is concerned, and we could refer you to a fertility clinic if you so wish. All right.
Right. Okay.
I would also like to suggest that women with higher weight to height ratio may not respond too well to the treatment, and also there's a risk of stimulation of the lining of the womb that could overgrow grow and bleed.
Okay.
Hence, it helps to lose a couple of pounds, so you could be attached to a dietitian and could follow an exercise routine. Does that sound good to you?
Yeah, I will consider that.
All right, then do let us know about your final decision and we would get the treatment arranged for you. In the meantime, we could get your investigations done and I would also be informing the consultant and write back to GP. Is that
Sure.
okay with you?
Yeah. Yeah. Sounds good. Thank you.
Thank you for your time.